Hey, I'm Glen Macnow. Welcome to Men's Health Matters. I'm here with Dr. Michael Sabia, Director of Cooper Pain Management Center. Dr. Sabia is going to answer the questions you have submitted on back pain. So here we go. Doc, you ready?
I'm ready.
Number one, can you recommend some exercises for lower continuous back pain?
Sure. So something that you're going to stick with throughout the test of time is really the best for what exercises I would recommend. Something that patients are going to stay compliant with, avoiding those high impact exercises, and the simple ones really that patients can do in their 20s, 60s, or 70s is yoga and Pilates. They really help lengthen some of the spinal muscles, stretch the ligaments deep in the spine, and those are two examples of true core exercises.
I know, when I watch yoga, I see those guys in the lotus position, and I say to myself, I cannot do that. So what do we do in that case?
You really could, Glenn. It just takes some practice. So practice, determination.
We'll film that in the next one. Okay. All right. Well, that's good. Next question. How effective is physical therapy for chronic pain? Chronic back pain, excuse me.
Sure. So, when we're suffering chronic pain, we usually learn what's provoking the pain. If we turn a certain way, that may provoke certain movements and pain that can radiate in my arm or leg or in my spine. And we also learn that avoiding certain movements help us deal with the pain and we don't have as many flare-ups. So what happens over time is when we're turning a certain way and that causes the pain, we stop doing that. Those muscles atrophy, they weaken, they shrink down. And we're always turning the opposite way because that doesn't hurt us. Those muscles get overworked and exhausted. Therapy really helps balance out that problem. It strengthens certain muscles that have become weak. It stretches out other muscles that are getting overworked and exhausted. So it's very effective in stabilizing that balance of stretching, strengthening, lengthening the muscles throughout the body.
All right. Well, here's the next one. We got a lot of good questions. And I'm very eager to hear your answer on this. Do you recommend a chiropractor for back pain?
So I do believe in chiropractic. I'm sure if you took a poll with different physicians throughout the world, some may be in favor of them and others not so much. But I think they play an important role in this multimodal therapy that we offer in pain management. That just means offering different modalities to help with pain. Massage, physical therapy, acupuncture, interventional pain injections, which we do. And chiropractic can add readjusting or realigning the spine, where sometimes it's just the simple joint that's out of place that they can manipulate, put back in place. That in itself can alleviate certain pain syndromes.
All right, very good. Here we go. Here's the next one. Every morning, I have shooting pains in my back and neck. Do you think that my bed is causing the pain? Oh boy, I tell you what, this one could be for me. I wake up and I got that back. Takes me, I got to walk around for 5 minutes. I'm sorry. Do you think that it's my bed causing the pain? And do you have any suggestions on how to wake up pain-free?
Sure.
So buy a new bed.
Yeah, that may be in the cards for you, but I would tackle that two ways. One is, what position are you sleeping in? And second is, what are you sleeping on? The position, a simple fix is really avoiding sleeping on your belly, face down. It changes the contour of our spine, and we're not really meant to stay in the face down position for prolonged periods. It's much better and safer for our spine health to sleep on one side with a pillow between our knees or on our back with our knees slightly flexed, maybe about 30 degrees, where you can have, a small pillow behind the knees. The next is what we're sleeping on. Avoiding the extremes of too soft and extra firm is probably the safe way to start. And then from there, we really have to tailor it to see what spinal issues you have. Is it a degenerated disc? Is it arthritis? Is it a herniated disc? Then we'd help be able to tailor a slightly firm mattress is a better fit for most patients. But again, avoiding the extremes is probably the best place to start.
All right. Here's what, if you can answer this, you're a magician. Do you have a quick solution for chronic neck pain?
That's a tough one.
And I want it now.
So most pain societies describe chronic pain as if you're suffering pain for at least 3 months, and other pain societies say you have to be in pain at least 6 months to be in that chronic category. So once you're in that chronic category, it is difficult to find one solution or a quick fix. But if I really had to hone in and pick one, it would be being more cognizant and changing your posture. So if you have chronic neck pain, in this day and age, this era, we're always looking down at our phone, and this face down position creates a lot of extra strain on the muscle, ligaments, and tendons
What are
throughout
you
the
talking
neck.
about? All right, here we go. How's
So-
this? Is that good?
That's the way to be, Glenn.
Okay.
Really. So
There you
the quick solution is really to have your shoulders back and chin back instead of being in that forward hinge position where
Boy.
you're face
I mean,
down.
that's me all day with my cell phone, right? That's everybody. How about that? All right, here you go. Good posture. Here we have it. I have had my L4 and L5 discs herniated. I've gone to the chiropractor. He's given me some relief, but I'm still not pain-free. Is there another way I can treat the pain, or do I just need to live with it? I would imagine live with it is probably not where you're going.
No way, not at all. There's a host of options we can do in patients suffering either cervical spine, neck pain, mid-thoracic spine, or low back pain at this L4-5 level. So the first step would be to have a consultation with a pain specialist, and we would be able to do a complete history and physical exam and ask questions of where is the pain, where does it radiate to, if at all, what does it feel like, what have you tried so far. Then we review the imaging that you've had done, if any, x-rays, CAT scans, MRIs, and we do a physical exam, certain maneuvers throughout the spine and body to determine what's really causing the pain. We put that whole story together, the exam, the results of the imaging, with your description of the pain, and we can make a decision if it's an oral medication that would help you, an interventional injection, more physical therapy.
Okay. If I were to ask you, I can only envision where the L4-5 is. Would you happen to have any way to show me?
Sure.
There you go. We got this good prop, man. Let's use it.
So we got the whole spinal anatomy here. There are 7 bones in the neck here, the cervical spine. That joins with your thoracic spine, color-coded here with 12 vertebrae. And then your lumbar spine has 5 vertebrae. The lumbar number 5 is actually the most common area where patients suffer back pain.
It's kind of right down there.
Yeah, it
Okay.
carries most of the load, most of the strain throughout our body. It really is involved in a lot of the torque and bending that we do every day, and that's joined to our sacrum. So the L4-5 is really the last 2 bones, vertebrae, in our lumbar spine, and that really absorbs a lot of the stress and strain of our daily activities of just standing, twisting, carrying objects.
When people, if people injure their spine, there's no particular place. It could be anywhere up or down the spine.
It could be,
Okay.
yeah. It could occur at any location. The lumbar spine is most common, followed second by the cervical spine, and then lastly the thoracic.
Okay. My father was diagnosed with spinal stenosis, and he's in constant pain. Actually, my dad is 85, and he has some degree of spinal stenosis. He feels it in his neck. I'm sorry, this is this person's question. He did have surgery several months ago. He is 90 years old. I don't think he should have surgery again. Can spinal stenosis pain be treated?
So yes, there are a lot of options we can offer patients, young or old, with spinal stenosis. And spinal stenosis is really a narrowing inside the spinal canal. We can measure the diameter, the width of that spinal canal with CAT scans and MRIs. And there is a critical level where when it becomes at a certain diameter or smaller, either filled with arthritis or a disc that herniates in the spinal canal. Some patients are born with a smaller spinal canal congenitally. There are treatments we can do both intervention-wise, where we can inject certain anti-inflammatory medications into the spine, treat them with oral medications that help with pain and inflammation as well.
All right, and last question for the day. And by the way, terrific questions. Really thank everybody for submitting them. What is the best course of treatment for whiplash from a recent car accident? My neck feels stiff. I get headaches every day.
So the first step would be to undergo a full evaluation by your primary care doctor. They would do, again, that history and physical exam, ask you questions about where the pain is, determine if an x-ray and or an MRI is indicated. Then depending on the results of that physical exam and those imaging studies, you may wind up seeing a pain specialist like myself for some interventional injections, physical therapy, acupuncture, oral medication management.
All right. Good stuff. Well, listen, thank you for your questions, Dr. Sabia. Thank you so much for
Thank
your
you,
time,
Glenn.
for your answers. To learn more about the pain management program at Cooper University Health Center, please visit cooperhealth.org. I'm Glen Macnow of WIP, thanking you so much for joining us.